Okay, and welcome everybody to this morning's DNP Scholarly Project Dissemination presentation. I'm Dr. Liz Rogan. I'm the course coordinator for the Scholarly Project courses, and it is my pleasure to introduce Dr. Tricia DeBoer, who has been Nick's faculty chair during this 3-semester journey. Tricia.
Unmute my,
yeah, there you go.
Yeah. Hi, everyone. Thank you so much for being here. I am pleased to introduce Nick Schwelbaum. He is going to do his presentation. I'm just going to give you a little bio on him. Nick's interest for his project developed from his own experience in the ER, as well as from his own experiences, such as being stepped on by a horse, along with seeing his friends go through an event related to trauma. His ultimate goal is to build a community together, such as Fort Calhoun, with preparing individuals, especially adolescents, on how to help others when a trauma event occurs. A little bit about Nick. Nick started his journey in healthcare following a traumatic event that introduced him to nursing. His past experience and passion for helping others helped him find his way into the emergency room setting. He currently lives in Sioux Falls with his family and works at Avera Hospital in the ER. He previously worked at UNMC as well in the ER. Along with his profession in nursing, he has held many titles, including professional rodeo cowboy, husband, dad, and soon to be a DNP FNP. All right, Nick, you can take the floor now.
All righty, everybody. First of all, I want to thank each of you for showing up today. This is a really big day, and I am super excited to share my work with you. So to begin, my scholarly project is Children Saving Lives in Nebraska Communities, a case study. Special acknowledgements go out to my faculty chair, Dr. Tricia DeBoer, my subject area expert mentors, Dr. Rebecca Davis and Shelley Schweethelm. To introduce us this morning, the purpose of this case study is to serve the community of Fort Calhoun, Nebraska by following an evidence-based framework to educate adolescents, develop preparedness, and increase the number of trauma first aid trained adolescents within the rural community. This case study will focus on adolescents living in the community of Fort Calhoun. This case study will take an in-depth look at the community of Fort Calhoun, assess the impact of trauma on the community, and assess the community's emergency preparedness. This case study will review the American Red Cross FAST course, which is a version of Stop the Bleed, but for adolescents, and we'll also review what adolescents can learn from it, how it is taught, and if it will be a solution for the nursing problem. So our nursing practice problem. Trauma is the leading cause of death for individuals under the age of 45 in the United States. Trauma events include motor vehicle crashes, accidental falls, shootings, blunt force injuries, drownings, and self-inflicted wounds. Fort Calhoun is in Washington County. The county has seen a 600% surge in trauma-related incidents over the last 20 years. Fort Calhoun is also a rural community, therefore distance to the nearest trauma center and volunteer response times play a large influence on trauma survival. Nebraska is also one of 3 states that do not require any bystander medical training of any kind in order to graduate high school. Adolescents are a high-risk group. They live in a rural community and have had little to no first aid training. These are all issues that need to be addressed in order to reduce the life-altering consequences of trauma. So right here, figure 1, this graph displays data from the Nebraska Department of Health and Human Services. It displays a very regular and predictable increase in trauma events year after year. This signal shows a worsening trend in leading cause of death for adolescents and young adults within the county. This graph also accentuates the threat trauma poses within the community of Fort Calhoun. And with little to no bystander emergency training, the community of Fort Calhoun is woefully underprepared. Our PICO question. So our population is the Nebraska adolescents. Intervention is offering a model for implementing first aid for severe trauma course. Comparison is no model. And our outcome is increase the number of trauma first aid trained adolescents. So with the full question, for adolescents residing in rural Nebraska, does offering a model for implementation of first aid for severe trauma course versus no model for conducting a first aid for severe trauma course increase the number of adolescents who are trained for emergency response? The review of the literature. There's limited studies completed on the American Red Cross's FAST course, which is a newly developed course and has not been utilized for a long period of time. Therefore, there was insufficient evidence and data to demonstrate that first aid for severe trauma would sufficiently decrease poor trauma outcomes in the rural community of Fort Calhoun. Therefore, the literature review's main focus was on how adolescents performed in other bystander emergency response training courses, such as CPR and Stop the Bleed. The literature review resulted in studies that investigated the various teaching styles, the lengths of the courses, and the different age groups, and how these variables influence the student's ability to learn. The literature review concentrated on finding the teaching methods that are the most appropriate for adolescents. So review of literature, the results, teaching styles. 3 main teaching styles available: in-person, online, and blended. The evidence indicated that in-person or blended courses proved the most effective teaching styles, and online-only learning showed to be the least effective. The length of the course. The optimal amount of time per training session is 120 minutes. Courses taking more than 240 minutes or more were less effective. Optimal ages. 2 sources determined middle age school, 12 to 14 age students were of optimal age, whereas 6 sources determined high school, ages 14 to 19, were the optimal age to begin training. However, based on these mixed results, it was determined that ages 12 to 19 were actually the optimal age to begin training. And so we come to our optimal solution, the American Red Cross FAST course. The American Red Cross's first aid for severe trauma, or FAST, is an optimal solution as it fits within best teaching practices per the literature. So it is an adaptation of Stop the Bleed, which is the adult course, teaches recognition of uncontrolled bleeding, how to stop the bleed, clear communication techniques, scene safety, and how to limit the risk for additional victims. It is offered in person, online, or in blended formats. It takes approximately 135 minutes to complete the course, and the recommended age is 19 years old or younger. So when we compare the literature review findings and the FAST course teaching methods, we see the FAST course falls within the optimal age group and can be taught using all 3 teaching methods. FAST is also taught within a reasonable amount of time at just over 2 hours, which includes the didactic portion, hands-on skills, and the certification tests. Overall, the FAST course fits within best practice teaching methods found in the literature review. So how do we implement the FAST course? So implementation. So for implementation, we're going to utilize the community-based participatory research model, or CBPR. It's a model which provides a framework for implementing a FAST course, evaluating its effectiveness, and developing a plan for sustainability. CBPR is designed to establish sustainable programs that improve health outcomes in high-risk groups, such as adolescents living in rural communities. And it is utilized as a way to accelerate research and effectively deploy community health interventions, such as the FAST course. There's no specific timeline introduced by the CBPR model. However, we will discuss a potential timeline in the execution step. CBPR requires community members to be part of the healthcare team, with a heavy emphasis on partnerships, is therefore required for the successful implementation of CBPR and FAST. So CBPR has 7 steps, which include the assessment, building partnerships, defining the problem, determining the action, executing the action, evaluation, and a plan for sustainability. First step in CBPR model is community assessment. The purpose of the community assessment is to develop an understanding of the public health issue. The assessment of Washington County in Fort Calhoun includes that Washington County has seen a dramatic 600% increase in trauma events. Fort Calhoun is also a rural community located 17 miles from Nebraska Medicine and 22 miles from CHI Bergen Mercy. These are the two closest trauma centers. Study I reviewed, Jarman et al. 2018, evaluated 16,000 trauma patients. They found that distance to the nearest trauma center was the greatest determinant of mortality. Based on their research, it was concluded that for every 5-mile increase in distance to the trauma center, mortality rose by 8%. Distance and a lack of trauma first aid training puts adolescents of Fort Calhoun at a 24 to 32% increased risk of mortality than their urban counterparts. Nationwide, trauma is the leading cause of death for everyone under 45 years old. This is an important statistic to remember. While FAST course is taught to adolescents, the trauma first aid and stop the bleeding techniques can be utilized on a person of any age. So the FAST course is useful to all the community members during a trauma event. The second step of CBPR is forming community partnerships. The purpose of this is to gain community perspective, trust, and support. Key Fort Calhoun community members to build partnerships with include school administration, coaches, teachers, parents, clergy members, the volunteer fire department staff, parents, and the adolescents themselves. Community members hold unique perspectives on major issues. Their insight could be a key component of the community assessment. Community members can also offer resources that contribute to the overall successfulness of the FAST course. Without community support, the FAST course is likely to be unsuccessful and unsustainable. An additional partnership included is Nebraska Medicine, more specifically the Regional 7 Disaster Health Response Team. Their primary objective is to prepare Nebraska for disasters, which include trauma events. They would serve as a resource for course instructors for not only the FAST course, but for other emergency training courses as well. These include CPR, AED, first aid, and stop the bleed for adults. Their representation of Nebraska Medicine builds credibility in the course because they are a community healthcare leader. Step 3 of CBPR is defining the problem. The purpose of this step is to pinpoint the exact issue that needs to be addressed. In this case study, while we identified many trauma-related statistics and a concern for a growing number of trauma events, trauma is going to happen. Humans make mistakes and accidents occur. The main issue is, what do the bystanders who witness the trauma do? Do they just stand and call 911? No. With proper training, they become the difference makers. Trained bystanders could very well be the difference between if someone lives or dies. The problem within the community of Fort Calhoun is the same problem affecting all of Nebraska's communities. There's limited trauma first aid training, and more specifically, not enough trained members of the most at-risk group for trauma, which is the adolescents. Step 4 of CBPR is determine the action. The purpose of this step is to identify the intervention that is most suited to address the problem. In this case study, the problem is a lack of trauma first aid trained adolescents. FAST course teaches recognition of uncontrolled bleeding, how to stop the bleed, clear communication techniques, scene safety, and how to limit the risk for additional victims. In a traumatic event, time is everything. When someone can die from life-threatening bleeding in a short period of time, early recognition and deploying stop the bleed techniques is essential for victim survival. Effectively communicating with emergency responders is essential for rapid response and getting the patient from the scene to the nearest trauma center. As discussed in the literature review, FAST utilizes optimal teaching methods to target a specific age group to deliver life-saving information and stopping the bleed skills. And with every intervention, we have to do a cost analysis. The purpose of the cost analysis is to understand if an intervention is financially responsible. If an intervention incurs a large cost with minimal impact, it is not likely to be sustainable. Currently, the American Red Cross is utilizing grant funds from the United States Department of Defense to offer FAST course for free to anyone under the age of 19 years old. So then determining the action continued, what is the target population and the settings? So the target population is adolescent residents of Fort Calhoun, Nebraska, between the ages of 12 and 19. Participation is voluntary with no exclusions of any kind. Participation is allowed regardless of socioeconomic status, race, sexual orientation, or gender. Participants can have previous first aid emergency medical training. The best setting identified is Fort Calhoun Junior Senior High School. The school offers a safe, central, and community trusted institution for hosting the FAST course. Readily available location with classrooms that can accompany the needs. Classrooms provide proper technology, which include Wi-Fi, PowerPoint, projectors, along with adequate seating for lecture and classroom or gymnasium space for hands-on skills portions. So then step 5 is in CBPR is executing the action. The purpose is to go from idea, research, and discussion to taking action. So step A is recruiting instructors. This is an important first step because FAST course is taught at a 24-to-1 student to instructor ratio. So knowing how many instructors that will be available ultimately decides the size of the course allowed to be held. Instructor availability will also determine the date and time of the FAST course. This determines the timeline in which to organize the course. Leaving an adequate amount of time to complete steps A through D is essential to the successful completion of the course. So then step B is setting the date. It's important to be mindful of instructors' availability and school activities in order to hold a successful course. Summer offers a great opportunity as the school is less occupied, students have more free time, and there are less holidays, and there are less school activities in general. So then step C is recruitment. Main recruitment strategies include advertisement, which should include printed signs, digital media, and utilizing school information distribution systems, such as their Facebooks, printed word, and other social media outlets. So easy sign-up methods is a must. Per the American Red Cross, sign up can be completed by instructors or course hosts. Then step D, on the day of the course, leave plenty of time for proper setup. This includes ensuring technology is working properly and all lecture materials are available. Step E, teach the FAST course. The didactic, hands-on, and testing should all be completed in about 135 minutes. Step F is the certifications. Names and emails of participants should be collected in order to award students their American Red Cross certificates. And then the timeline. Once students are recruited, 30 to 60 days, once instructors are recruited, 30 to 60 days should be allowed for proper planning, preparation, and recruitment. Step 6 of the CBPR model is evaluation. The purpose of this step is to understand if the intervention was effective or not. Evaluation for the implementation of FAST course includes if there was a significant rise in the number of trauma first aid trained members of the Fort Calhoun community. Other evaluation questions could include how many students attended, did the class fill up, and number of students that successfully completed the course, and were the teaching methods correct? An evaluation of this case study in the future includes, does offering a model for the implementation of FAST course increase the total number of communities in Nebraska who are hosting FAST courses? As well as, are students able to retain the knowledge and skills learned from the FAST course over a period of time? And then step 7 of CBPR is sustainability. The purpose of evaluating sustainability is to determine if the FAST course adequately addresses the problem within a reasonable amount of time, energy, and budget. Nebraska is one of 3 states that does not require any emergency response training to graduate from high school. Legislative Bill 365 would have made CPR training a requirement to graduate high school in Nebraska. It ultimately failed due to the budget expansion of $1.2 million. Bill 365 did not have financial or community support significant enough to pass. For a FAST course to be sustainable within a community like Fort Calhoun, it must have community support, demand, and remain cost efficient. At this time, FAST is still subsidized by the Department of Defense. But if that funding is no longer available, we have to ask, what is the price tag of it and who pays for it? So then, dissemination plan. The purpose of dissemination is to share this case study. This case study is intended for anyone who has the ability to initiate a FAST course within their community. This includes teachers, parents, healthcare workers, and even the students themselves. Fort Calhoun is not the most rural community in the state. What about the Nebraska communities that are 50 or 100 miles away from the nearest trauma center? The adolescents in these communities are at an even greater risk. Until legislature can change and emergency bystander training is made a high school graduation requirement, it falls on everyone to recruit more communities, engage in forming partnerships, and provide learning opportunities for Nebraska's adolescents. And so we come to our conclusion. As someone who grew up in a rural community and worked as a trauma RN in a level 1 and level 2 trauma centers, I've witnessed the difference bystander trauma first aid makes on a victim's life. The willingness and the courage to take action derives from confidence that comes from being prepared. The purpose of this case study was to provide a model to implement the FAST course within a rural community. The goal of this is to increase the number of trauma training opportunities for Nebraska's adolescents so that we may increase the number of trauma first aid prepared bystanders. With trauma being the greatest health threat to Nebraska's youth, having trauma first aid training is an imperative confidence booster and essential skill set for our state's youth. The worst day on anyone's life is the day they witness or are the victim of a trauma. So as a community, let us prepare them to take action, display courage, and demonstrate that children can, in fact, save a life. I just want to thank all of you again for coming, and a big shout out to all my supporters that came in today. So any questions, anyone?
Nick, it's Shelley, not a question necessarily, but more so about rethinking, I think, especially here in Nebraska, but I think we have an opportunity in Region 7 through our disaster grant to really push again with the trauma advisory committees in each of the 4 states and take another run at maybe legislative changes. So I'll look up that bill and see if there's learnings from that, and then talk to our trauma team in Region 7 about whether or not they've tried to take that back and push it forward. How many states again is there that don't have? Do you remember? I know Nebraska is
3.
one of just 3 states who don't have it in the curriculum.
I believe it is Nebraska, South Dakota, North Dakota.
Okay. All right. So anyway, I think that's a good next step. So
Shelley, I am so glad that you brought that up. Because as Nick was talking, I was thinking the same thing. I mean, I think it would be a wonderful side project, as you're getting used to being a new family nurse practitioner, Nick, and handling, 2 small children and all that good stuff, to really go out there to those communities that are, further away from trauma care, and just, and doing the legwork and finding out, okay, how many accidents have happened, or how many traumatic events have happened that, could have been, the effects could have been different if for this training, and getting that boots on the ground information that could lend itself to supporting another legislative bill.
Yeah.
I just have to commend you for using a community engaged approach. And I think you effectively gave us all good pause to think that can be a nurse-led effective approach. And it's also population focused, which I think is critical in being able to do any policy development.
The other thing I really like about the FAST program is that it can be free. So through the Red Cross for these high school students can be free. So therefore, there's really not an access or equity issue either for people to be able to learn. If they truly want to participate, if you can get the ownership at the grassroots at the school level to do the program, there's opportunity there, I think, to make sure everybody has an opportunity to learn it.
Yeah, which was the big point of the presentation, was that anybody can follow these steps. You don't need to have an active license in anything particular. The students themselves can find this and be like, okay, we're going to reach out to a set of instructors and we're going to set a date and we're going to get all of our friends in here to do this. I mean, it's a intervention that can be from people, from students to, all the way up to presidents of hospitals. So they see a need in their community.
Nick,
I have.
oh, sorry.
Sorry. No, go ahead.
I want to tell you that I thoroughly enjoyed listening to you, and that I like the little nugget about the type of person that comes upon a trauma and you help, or you're the one calling 911. And so I would always be the one calling 911, right? Because I didn't have any of this kind of training. So, and then you also said, if you're given the confidence to step in, like high schoolers are amazing kids, and if we're out there teaching them and giving them this tool early on, then who knows how far it could go to save lives. So thank you. This was wonderful for me to listen to, very eye-opening.
Yeah, and that confidence comes from my own experience. It comes from my experience as a nurse, but then also, being in a trauma event. I like on my nursing experience, it took a lot of time for me to step in and help with the code, or to step in and help in those traumas, because I was not confident in my skills. So then if we look at, in a trauma event, I think back and I go, would I have been able to help myself? I rolled a car once, and luckily it was snowing and the impact was minimal, and I was wearing my seatbelt and I had no injuries. But if I had gotten an injury, would I have saved myself? Would I have been able to save myself? Or when I was alone on my parents' farm and I got my face stepped on and like my bleeding was minimal, but what if I had been putting my arm in a piece of machinery, which I had done hundreds of times, and now I've got arterial bleed? Would I have been able, these are the questions that I ask myself, and trying to put myself into the position of an adolescent living in Fort Calhoun is like, okay, could I have saved myself in high school when I was doing all of these silly things?
We're gonna have to compare horse stories sometimes, Nick. We had a mare who just loved to go to horse shows and loved to come home. And one time she conked me on the nose or on the head, and I had to go down to the ER and get stitches. And the other time she degloved my finger, pulling it through the window. So yeah, we'll compare horse stories sometimes.
I just have two things to say. First of all, just speaking as like a nurse, and I think there's a few nurses here, or just even people in healthcare. I think about how now we can introduce people to healthcare and give them that inspiration to like pursue nursing or pursue being a doctor, or like we know that there's a shortage in those aspects. So this would be another opportunity for us to like engage into their future of, well, if you really like this content, why don't you look into a healthcare job, you know?
That's a good idea.
So, and then the final thing I just wanted to say, Nick, great job. You have been wonderful throughout this, and your inspiration and just determination has shown through. I know that we didn't get IRB due to time circumstances. We didn't get IRB, but you did pursue going through this process with Fort Calhoun to start the initiative. Can you just speak to that briefly? Because I know we're getting short on time, but just anything you want to share about your experience?
Yeah. So last summer I decided I needed to walk the walk and not just talk the talk. So last summer I actually did hold a FAST course at Fort Calhoun Community School. It was in conjunction with the Region 7 team. Because I did not have IRB approval, I couldn't do any sort of evaluation or data collection, which would have been very helpful in terms of, moving in the legislature side. We have to have some sort of hard data and research that says we need this every year or every other year or once in junior high and once in high school, in order to prove to the people in power and the ones who make the legislative decisions that this is something that needs to be done for our communities. So it was a bit of a blunder on not having IRB, but I think as far as proving the process works, I think it did help there. And I feel confident that if anybody asked me to review this case study, that they could then initiate a FAST course within their community. So
did you learn anything from that experience that you're like, okay, I knew what didn't work and I hope to grow from that, or like community outreach?
Leave yourself more time than you need, that's for sure. Which has been Shelley can talk to this, which has been the song of my entire life. Organization and leave more time than you need. So
well, I mean, as far as you've gotten, you're doing really well.
Nick, I would love for you to try to present this at a meeting. Maybe it's the Nebraska Nurse Practitioner Association. I don't know if that's the right name, or even a regional meeting, especially one in one of these rural states that doesn't have, any kind of mandatory education. But also, I think nurses and nurse practitioners, healthcare providers across the country would be interested in this, if only to reach a community population that is considered a vulnerable population. I think you would be well received just about anywhere to give this presentation.
Well, thank you. I appreciate that.
Okay, are there any other questions, comments, applause? Thank you. Soon to be Dr. Nick. Makes you sound like a TV doctor. Well, congratulations. You have done a yeoman's job and shouldered the burden quite nicely. We're really proud of you. Thank you for your efforts.
Well done, Nick.
Thanks everybody for being here today to support him.
Thank you.
Bye.
Bye.
Appreciate all of you.